And doctors are warning the data from the Ministry of Health on COVID-19 is not representative of the true infection rate as the testing levels remain low. The doctors under the Kenya Medical Association are calling for a cautious reopening of the economy to avoid a second wave of infection. There's even as calls mount for the gradual reopening of schools, with teachers expected to report back to school beginning tomorrow. Caroline Kamau begins our broadcast.
To open or not to open the economy is the question the head of state is grappling with ahead of Monday, when teachers are expected to report back to school to prepare for the resumption of learning. And as the country awaits communication from the government on the reopening date, the Kenya Medical Association is calling for an evidence-based approach in determining when to reopen the economy. The medics are warning the testing levels in the country are very low, making it difficult to draw an actual picture of the COVID-19 situation in the country.
We are continuing to see low levels of testing in the country, and initially we used to have mass testing. Now it has moved to targeted testing of only the symptomatic patients, and this information that we're being given by the Ministry of Health is not enough to provide us with accurate data that we can use to inform the opening of the country. So we like to urge the government to ramp up its testing, to consider screening using the antibody test, so that you can have a clear indication where we stand as a country as far as COVID is concerned.
The body is, however, supportive of a gradual reopening of the economy, emphasizing on the need to equip the health sector in case of a surge in transmission when government eases restrictions.
On healthcare workers' protection, it has continued to be an issue. As we speak now, we still have healthcare workers who do not have access to quality PPEs in many of our counties. And 7 months down the line and you're still facing this problem is something that leaves a lot to be desired. So we like to...
At the same time, they're calling for stringent measures to ensure safety of learners.
Kati COVID-19 ilipokuja nchini, nchi ilifungwa ili wanadau wote waweze kuweka mikakati ambayo itasaidia kufungua uchumi tena. Mashule pia yalifungwa ili kwa wakati huo watoto wasiambukizane, na shule zenyewe zilihitajika kuweka mikakati ya kurudi shule. Ingekuwa vizuri ya kuwa na tuseme zahanati kidogo ndani ya mashule, kuwe na daktari, kuwe na muuguzi, kuwe na watu ambao wanaangalia afya, hata wale wanaitwa public health, kuangalia afya ya shule. Ni vizuri bodi za mashule ziweke hiyo mikakati, na ndio maana tunasema hata kama ni Oktoba, hata kama ni Januari, hiyo mikakati ndio inafaa kuwa imewekwa.
And as the doctors urge for caution in Kilifi County, the management of Ngala Memorial Girls Secondary School is preparing to receive learners in line with the COVID-19 safety protocols. The school's principal, Elizabeth John, says they are in the process of constructing a new dormitory that is expected to accommodate 150 students to ensure social distancing.
First reopening, I mean, we can have our candidate class first, and maybe after 2 weeks, because I know that once these students are in school, they are safe. So after maybe 2 weeks or a month, then we can have the other class coming in. Maybe after a month or so, then we can have the other. Just gradual opening is better. Yeah.
There's also a sanitarium within the compound, which will be used as an isolation center in case students exhibit coronavirus-like symptoms. Caroline Kamau reporting for Channel 1 News Hour.